Hi, my name is Mimi, and today I'm going to be doing my head to toe assessment with my fiance. I've already done my integrity checks and uploaded the consent and my ID. Right now, this is part of my integrity check. I'm going to go ahead and scan the room. We're in the living room. So, this is a table. I have one sheet of paper here, one sheet of paper that is blank. There's no notes on there. Here's my pencil. I have my equipment right here. I have the pillows for comfort that she's going to lay on, and I have the blanket to cover her. And then down the hall, there's nothing. On the ceiling, there's nothing. We have some dog treats if you care. This is the kitchen. I'm just going to go around the whole kitchen so that you know that there's nothing here. And then behind me, the kitchen, there's no notes, no papers. This is just a sticky note that's saying good luck. That is it. And it is flipped over. There's nothing there. Okay, going over through here. Oopsies. There's the floor in the kitchen. Okay, coming back around here. There's nothing. Okay. And then the living room. This is a big ass living room. There's nothing. Here's the ceiling as well. There's nothing all the way around. There's nothing. Do I have your permission to do a okay, and then do I have your permission to do a physical and upload it on YouTube as unlisted for my instructor to grade? All right, great. All right, so we're gonna start now. I'm gonna leave the camera there for now. All right, so I'm gonna start now, and I'm just gonna do a quick brain dump. I'll probably go back and forth. Have to get you to scoot over just a tad bit. Sorry. All right, just gonna do a brain dump real quick. Oh, oops. Oh, MOM for musculoskeletal, obesity, mental illness, cancer, endo, respiratory, bleeding disorders, GIGU, bleeding disorders, and there's the last one. Oh yeah, neuro. Okay, awesome. All right, so I'm gonna start by washing my hands. I have some sanitizer. All right. Hi, how are you? I'm good. Thank you for asking. My name is Mimi. I'm going to be your nurse practitioner today. I'm going to be doing your annual checkup, and let's get started. Okay, can you start by, I'm going to ask you a series of questions. Let me know if they're too fast or if you're getting confused about anything, okay? All right, perfect. Okay, can you start by telling me your first and last name, your age, date of birth, gender, date of birth, gender, race, and ethnicity? All right, thank you for that. What brings you in today? All right, great. Wait, what? The yearly physical assessment. Okay. All right. So in my HPR, I'm gonna put in quotes. I just need to get a yearly physical exam. Is that what you said? A yearly physical exam. And then if she was here for a focus assessment, I would use my old card, which is onset location, duration, characteristics, aggravating, relieving time, and severity using a pain scale of 0 to 10. That's not what we're doing. So we're doing a full on assessment. So moving on, when was the last time you had your physical, eye exam, and dental exam? Great. Any abnormalities? No. Okay, great. Have you ever been exposed to any type of infectious diseases such as TB or hepatitis? No. Do you have any past medical history or chronic illnesses that led you to be in the hospital? No. If she did, I would write down what the illness was, the diagnosis, when, and what treatment she's on, and how it came out. Okay. Have you had any surgical histories? No surgery at all. Okay, if she did, I would ask what surgery was, what year it happened, or what year it was, if there was any complications with the surgery, and if there's any complications with anesthesia. Can you tell me if you have any childhood injuries or adult injuries that landed you in the hospital? No? Okay. And then do you have any allergies to medications? Great. Okay. So I'm going to note penicillin. What is your reaction to it? Great. I'll note that as well. Any other allergies? No. Okay, great. Do you have any allergies to like food, latex, or seasonal allergies? No. Great. If she did, I would notate the allergy and the reaction. Are your childhood immunizations up to date and your adult immunizations up to date?
Yes.
Did you take your seasonal vaccine and the COVID vaccine?
Yes.
Great. And then moving on, are you taking any medications at this time?
No.
If she was taking any medications, I would notate the name, the route, the dose, the frequency, and the reason. All right, moving on. When was your last menstrual period?
15 days ago.
Beautiful. Were there any irregularities with that,
No.
or any heavy bleeding, or any abnormal symptoms that you've ever had? Great. Okay, so now I'm going to ask you about your sexual history. So, are you sexually active?
Yes.
How many partners do you have?
One.
How do you prevent pregnancy and or sexually transmitted infections? Thank you. Great. All right, that's good. All right, and then also I'd like to educate you in sexual reproductive health. Per the American College of Gynecology, they recommend a pap smear every 5 years with cytology. And then they also recommend um, a breast exam, which is called a mammogram. Do that every year. That's an annual thing. And then also you can do monthly breast exams at home. You can do them sitting or lying. You're going to move in a real-like fashion, looking and checking for any lumps or abnormal tissues around the breast area, along with any type of discharge from the nipples. Okay, thank you. And then also, if it was a male, I would let him know, especially if he's high risk, that testicle exams at home are recommended out of the shower when the skin is warm. They're going to use both their hands. They're going to palpate the testicles and notate any type of pea-sized lymph nodes or any type of swelling or any abnormalities with any lumps or anything like that. Okay, thank you. Moving on. Move on to your social history. I'm going to ask you a series of questions. Where were you born? Who do you live with?
My fiance.
Is this a healthy relationship?
Yes.
Any violence or domestic violence? No. Any guns at home?
Yes.
Are they locked and put away?
Yes.
Do you use a seatbelt when you drive?
Yes.
Okay, great. Ask where do you live, right?
Yep.
And who do you live with? And where were you born? I asked all that, right? Okay, what are your hobbies? Great. Do you exercise?
Yes.
How many times a week do you exercise? Beautiful. Do you have a diet plan?
Yes.
Okay. Is it like high carbs or is it just high in? Beautiful. I love that. All right, good. And then do you have any spiritual practice or alternative health practices? Beautiful. How do you deal with stress? Beautiful. I like that. And then also, do you have any use of, I'm sorry, do you use alcohol, drugs, illicit drugs, marijuana, cocaine, or roofies or anything like that? Okay. Do you have an emotional support family or supportive circle? Okay, great. And then um, do you smoke cigarettes, vape, tobacco, nicotine, or anything like that? Okay, beautiful. And then and your hobbies is that, and your activities. Oh, do you have any sleep disturbances or anything like that? No. Okay, great. And then the next thing I'm going to move on to, I'll come back to that if I remember anything. But the next thing that I'm gonna, oh, what's your occupation? Oh, great. Okay, good. Thank you for that. And then, what's your relationship status? Thank you. And then also, I'm going to move on. So I'm going to move on to your family history. And when I say family history, I mean that I'm going to ask you about your children, any siblings, your parents, meaning your mom, dad, your maternal and paternal grandparents. Okay. Do you have any children?
No.
Do you have any siblings?
No.
Great. And then what about your maternal and paternal grandparents?
On my other side, they passed away naturally in their 80s.
Okay, great. But your paternal, you don't know?
No, I don't know anything about my father and my father's side.
Oh, okay. All right. And then, so just your mom then?
Correct.
Okay, cool. Well, let's go. Do you know any history about your mom? Any health history?
I believe she's healthy.
All right, let's go down a list of mine. A list and just check through your family history. Do you have a family history of anybody with headaches or migraines?
No.
Musculoskeletal, do you have anyone that has any joint or low back issues? No. Obesity in your family? Is there any type of mental illness in your family? I also wanted to ask you if you have any history of mental illness with hospitalizations. If she did, I would notate what the mental illness was, if there was any medications, and what occurred with any hospitalizations. Okay, carrying on. Any history of cancer, such as thyroid cancer, breast cancer? Okay, what about any, as far as endocrinology goes, any hot flashes, any thyroid disorders, any type of sweating at night that you're aware of? Okay, what about any type of respiratory issues, such as COPD or asthma, or any emphysema in your family? Okay, what about cardiovascular, like coronary artery disease or heart attacks or anything like that? Okay, what about in GI? Does anyone have any like diverticulitis or any type of issues with the GI, like nausea or vomiting, acid reflux, or anything? Okay, what about GU as far as UTIs or hematuria or any type of bladder issues or anything like that? Okay, what about any bleeding disorders, hemophilia? Okay. What about any genetic disorders such as sickle cell or Huntington's disease or celiacs or Cushing's? Okay. And then what about neurologically? Any seizures or Bell palsy, lightheadedness or dizziness? Okay, beautiful. Now I'll move on to the same review of systems just for you yourself. Overall, in your general, oh wait, sorry, before I get there, let me write this down. General health. Okay. Also, I wanted to ask you, have you had any issues with any blurry vision or headaches? Have you had any double visions or anything like that? Any issues smelling? Any mouth issues like with chewing, any sores around your mouth, any sores in your tongue, any sore throat or anything like that? Any have you had any issues with weight loss or weight gain? Have you had any like mental illness disturbances like mood disorders or depression or anxiety? Okay. Endocrinology wise, have you had any hot flashes or nighttime sweats that are unexplained or any hormonal changes? Okay. Do you ever feel short of breath or any palpitations or like you can't catch your breath? Do you have any chest pain or anything like that? Okay. What about any nausea, vomiting, diarrhea, constipation? What about any urinary issues or urinary frequency, any flank pain or anything like that? Okay, do you have any type of like clotting disorders or bleeding disorders, like where you can't, your blood won't clot or you're having a longer time healing, anything like that? Okay. What about neurologically speaking? Have you ever had any seizures or do you feel any auras or anything like that? Have you ever had any experience with Bell's palsy or anything? All right, any joint stiffness or weakness or anything like that? All right, beautiful. Thank you for that history. And then now, I'm going to move into your physical exam. I'm going to move into her physical exam now. And right, for the physical exam, I'm going to ask her her overall health. So, your overall general health, have you had any fevers, chills, unexplained weight loss, or weight gain?
No.
Overall, you feel good? All right. So, overall, before I start this exam, I noticed that she is, I'm just looking at my time. Okay, overall, before I start this exam, I noticed that she has great body posture. She looks healthy. Her skin, I'm assessing first before I touch, but I'm going to assess your skin turgor and note that you are hydrated. I noticed that her AP diameter is 1 to 2. Her skin is normal. It is not, there's not any discoloration, any lumps or bumps or bruises or anything like that on her skin. Overall, she looks good, well nourished. Also, I'm going to check her skin turgor just to palpate skin turgor and feel if it's dry or moist or anything like that. Any like rashes or lesions or anything like that on her skin. I don't see any. Also, you note that she is alert and oriented because I asked her about her first and last name, date of birth. Do you know where you are today?
Yes.
Where are you?
In my home.
All right. What are we doing today?
A yearly assessment.
All right, great. And all of that is intact. She's ANO times 4, no type of issues. So I'm going to start with the exam now. And oh yeah, I just also wanted to show you my cart that I'm using. It's just nothing is in there. I'm just putting my stuff at the top. That's all I'm doing. Okay, and we'll go back to this. And I'm going to start with, got it. So I'm going to start with, I'm just going to keep this cart in the vision of the camera so you can see it. I'm going to start with the hair. Your hair, skin, and nails. So your hair, I'm going to notate that her hair is nice. It is washed, it's clean. There's no bugs crawling out of it or anything like that. It is not coarse. It is not thin. There's no alopecia. It's not um, thready or what am I looking for? The texture, shedding or anything like that. And then I'm going to look at your hands, please. And I'm looking for any clubbing, any cyanosis, any type of tar on her fingers like she smokes and she says she doesn't smoke. I'm going to look and make sure that the skin is pink. There's no, the cap refill is good to go, less than 3 seconds. There's no crepitus or anything like that. And then, so moving on down from your face, moving from your hair, skin, nails to your face. I'll check the skin all the way down, their lower extremities and her feet and her toes. There's no clubbing. There's no nasty toes. There's no yuckiness in her toes, meaning any skin issues, any calluses or corns or warts or anything like that. Okay. And then I'm going to move back to your face. I'm noting that it is symmetrical. I'm noting that there's no, I'm going to also start palpating. I noticed that there's no thinning, there's no abnormal structures, there's no asymmetry, there's no lacerations or different types of sizes or shapes or any traumatic experiences or any trauma, no trauma. Her face is symmetrical, eyebrows are symmetrical. I'm looking at her eyes. I'm sorry, before I go to the eyes, I'm going to go to cranial nerve 5, which is trigeminal nerve, and I'm going to check whether it's dull using this. So I'm going to check, keep the camera in view of everything I'm doing. I'm going to check and make sure that it is dull and sharp. Please close your eyes. Let me know if you feel dull or sharp.
Dull, dull, dull.
Beautiful. And then the next thing that I'm going to note is that your face is symmetrical. Also, go ahead and push, open your chin or open your mouth. Okay, chin strength is great, 5 out of 5 strength. And then I'm going to move on to facial, which is number 7, cranial nerve number 7. I'm going to have you scrunch your eyebrow, your forehead up. Beautiful, symmetrical. And then I'm going to go, that's the upper part of the face. And I'll go down to the lower part of your face and have you give me a big old smile. Beautiful. And then puff your cheeks out. Good job. Okay, so everything is symmetrical, no abnormalities there. We're moving to my eye exam, and I'm gonna do direct light. I'm gonna dim the lights down for this a little bit, and then I'm gonna use direct light along with consensual and accommodation. So starting from the right side, I'm going into the right eye. From the left side, I'm gonna come in and see that there is a constriction. And then I'm going to come in again and know that there's consensual with this left eye. Coming in from the other side, sorry. In, direct, in, and there is consensual movement from this right eye. And then for accommodation, I'm going to have you look at the pin. I'm out of order. I can feel it already. All right, just look at the pin and then look off into the distance. Beautiful. Look at the pin again, off into the distance. Beautiful. And I know that her eyes do accommodate because when she looks at the pin, there's constriction. When she looks out into the distance, there is dilation. So normal accommodation and consensual. I'm going to start here with my Snellen chart as well for the eye exam, which I should have did first, but it was reversed. So anyways, I'm going to hold it here. It's going to be 6 feet back or on a wall, it will be 20 feet back. I'll have you cover one eye and read the lowest line that you can.
LTFPH.
Beautiful. Cover the other eye. Switch. Lowest line.
LTFPH.
And then no covers.
LTFPH.
Beautiful. Do you wear contact lens or glasses?
No.
Okay. You will note that she has bilateral 20 out of 20 vision with and without glass, or with and without, I'm sorry, in the left eye, the right eye, and without any coverage with both eyes. Is 20/20 vision uncorrected. Okay. And then moving on to my confirmation, testing the peripheral field using accommodation. So I'll go ahead and have you cover one eye. Cover one eye, and you tell me when you can see my fingers in your vision.
Yep. Yep.
And you notice I'm coming anteriorly to posteriorly. I'm sorry, posterior to anterior. Cover the other eye. And come here.
Yep.
Beautiful.
Yep.
Beautiful.
Yep.
Nice. And then no coverage. Both eyes open. Look straight ahead, not at me. Okay, good.
Yep. Yep. Yep.
Beautiful. Visual fields are normal. She can see just fine. This is cranial nerve 2, optic nerve. Cranial nerve 2, the optic nerve is what I just got through. Ooh. Aw, damn. I'm just going to lean in and get that fell under the table. Oh, God. It just fell under the table. That's what I felt, because it's the wrong damn thing. Sorry. All right. So now, after the peripheral view test, I'm going to move into my ophthalmic, my fundoscopic exam. And then here, I'm going to dim the lights for this as well, have you look straight ahead. So what I'm going to do is come in on the right side. So this is the patient's right eye. To my right eye, my right hand with 2 fingers. The other ones are 2 fingers. The rest is going to be on her cheek for protection. My back hand is going to be here to protect as well, and how far I go in. And when I come in, I'm going to come in from this way. Look straight ahead. Okay. I'm going to come in from this way, and I'm going to locate the retina. I'm going to have my hand here for protection, locate the retina, and note that the lens is clear. There's no obstruction. Moving down into the pupil, note that it is clear and there's no obstructions. Moving into the retina, notating that I can now see the retina is clear. The retina is orangish reddish, orangish color, creamish like. And then I'm going to move into the fundoscopic view. And I do note that I see the fovea and the macula, which is clear, crisp vision. I notate that I see the disc to cup ratio, which is a 3-to-1 ratio. I'm also notating that there are no nicks, no type of inflammation with the veins and arteries. The arteries are red, the veins are darker in color. This is probably only a structure that you would see that the veins are larger than the arteries. I'm going to do the same thing on the opposite side, and I'm going to take my left hand this time for my left eye, the patient's left eye. I'm going to use my dominant hand. I'm going to use my dominant hand to protect, and I'm going to go in, notating all of the same exact structures are normal and bilateral. Thank you for that. And then I'm going to move on to cranial nerve 1, which is your olfactory nerve. I'm going to have you, first thing I'm going to do is I'm going to notate that that it is symmetrical. There's no type of lumps or bumps or bruising or any type of septal deviation in her nose. It does look normal and it is symmetrical. I'll have you plug one nose and pull a deep breath in. Beautiful. Another one. Beautiful. All right. Right and left narrow is patent. And then I'm going to have you do the smell test in 1. I'll have you close your eyes, and then I'll have you plug one nose. And careful with your deep breath in.
Cinnamon.
Cinnamon. It's cinnamon. Put that there. And then close your eyes. Oh, shoot. Sorry. And then I'll have you smell again.
Peppermint.
Nice. All right. Peppermint essential oil is what I have here. All right. And then I'll go ahead, take this moment here to look up inside your nose. I'm going to be very careful, notating that everything is very sensitive. The vascularity of the nose is super sensitive. And what you don't want to do is cause a nosebleed. So I'm looking in and noting that the turbulence are clear and they are not obstructed. There's no rhinorrhea, no, in both nares, there's no rhinorrhea or anything like that. And it's patent airway. It is a, whoopsies, it is a patent airway. And I don't notate any abnormalities, no polyps or any nasal polyps or anything like that. Thank you for that. Then we're going to move on to cranial nerve. Oh, also, what I forgot to do before I move on, and then the eye exam, I forgot to say that we can skip the corneal reflex, because I don't, just for comfort and for the sake of this video. I also want to palpate her maxillary sinuses. Any type of pain when I touch here or here, anything like that? No? Okay, good. I'm going to skip the corneal reflex. And then I want to move on to the acoustic, which is going to be your ear. And before I touch your ears, I'm going to be notating while I'm getting my equipment ready. I'm going to be noting that there is, can you just look straight ahead? Thank you. And then it's going to be symmetry with her ears. There's no lumps, bumps, bruises, or any type of drainage coming from her ear, no redness, no swelling. I don't notice anything abnormal. So I'm going to go ahead and touch here now. Open up your nose. I'm going to touch. I'm going to pull on your pinna. Do any pain when I touch or pull? All right. And I'm pulling the tragus. Any type of pain or anything like that? The earlobes? Nope. No pain. All right. So now I'm going to note. I'm going to go inside the ear. So I'm on the right side. So let me go on the right side first. And for an adult, you're going to pull up and back. Sorry, you're going to pull back and up. A child is going to be back and down. So she's an adult. We're going to go back and up. And so I'm going to notate going into this auricle part of this inner canal of the ear. I'm notating the auricle, the pinna, and all that looks normal. There's no type of swelling or drainage or anything like that. When I go in, I'm going to notate the, when I go in, I'm going to notate the temporal membrane. I notice that I see the oval and the head of the malleus. Everything is normal. There's no drainage. There's no any type of purulent secretions. I note that the cone of light on this side, on the right side, is at 5 o'clock. It's at 5 o'clock. And then I note that all bony structures are intact. There's no abnormalities noted. The tympanic membrane is grayish, pearly gray in color and clear. And then I'm going to go ahead, sorry, excuse me. And then I'm going to go on the other side, which is her left ear. I'm going to do the same thing, pull up and back, look down into the structures, and I notate every single thing that I saw on the other side. It is bilateral, normal, no abnormalities noted. All right. And then after this, we're going to go ahead and do the hearing test. And when I say hearing test, I'm going to do the whisper, the Weber, the rhyme. So for the whisper test, I'm going to come here and I'm on this right ear. I'm going to be 1 arm's length, and I'm going to go ahead and whisper a combination of letters and numbers. Can you plug your ear, your right ear? I'm sorry, your left ear. Sorry, good listening skills. All right, and then I'm going to whisper 2RM. One more time, 2RM. Beautiful. And then I'll switch out and go on the other side, which I should still be in the camera. Okay, I'm still in the camera. So I'm going to be arm's length over here and 2 feet back. And I'm going to whisper L25 or L2S. Beautiful. All right. And she plugged the other ear, which is great. Next, moving on to the Weber's test. And I'm going to bang it on here. Bring it to the, can you look straight up? Middle of the forehead. Boom. Where do you hear it?
Both ears.
Both ears. There's no unilateral, one side or the other. Beautiful. That's a normal finding. And then we'll go on to the rinds. Put it on the back of the mastoid bone. Please tell me when you can't hear it anymore. And then let me know in front of the canal when you can't hear it anymore. Good job. All right. This is where you see that AC is greater than BC. Air conduction is greater than bone conduction. Move in on the same side. On the opposite side, sorry. On the mastoid bone. Tell me when you can't hear it anymore. Okay. And tell me here in front of the canal when you can't hear it anymore. Beautiful. Same thing on this side, bilateral findings. AC is greater than BC on that side as well. All right. Thank you for that. And then, okay. So then I'm going to move on to the next cranial nerve, which is going to be your mouth. Okay. So it's going to be cranial nerves 9, 10, and 12. The glossopharyngeal, the vagus, and then the hypoglossal. Starting with the glossopharyngeal first is going to be your mouth. So I'm going to look around the mouth, inspect that, see if she has any bumps, any oozing, any redness, any swelling, any dryness, or any type of sores or anything that just is not right around her lips. Go ahead and open your mouth for me. Open up wide. Say ah.
Ah.
Say ah. Stick your tongue out. Beautiful. I saw rise and fall. I saw the palate, the soft and hard palate rise up with the uvula. It is symmetrical. Open again, please. I'm looking all around the buccal mucosa. I'm noting the dental caries, noting if she has anything on her tongue, any type of thrush, any type of scrapes, any type of redness, swelling. You put your tongue back a little bit, and I'm looking underneath her tongue. Lift your tongue, looking underneath her tongue, looking all around the lungs of the gums, noting any gingivitis or halitosis or anything gross, just like that, which I wouldn't say gross there. I was just saying it in my head. And noting any swelling. Okay, you can go ahead and close. I'll have you swallow. Beautiful. Both cranial nerves are intact, the 9 and the 10. And then I'm going to go ahead and go to this hypoglossal. Stick your tongue out for me. Beautiful. It is midline. Move it left and right. Beautiful. And it's strong. And then come pull it back in. And then go ahead and puff out. No, pull it back in. And then puff out your cheeks. Stick your tongue on one side. Go against the resistance. Turn towards my hand. Beautiful. Same thing on the other side. Turn against my hand. Beautiful. Equal strength. 5 out of 5 strength. Okay. Beautiful. Moving on, I'm going to move on to cranial nerve 11, which is a muscle accessory. Have you sit up tall? Beautiful. And then I'm going to put my hands here and have you shrug your shoulders. Shrug your shoulders. Beautiful. Equal strength bilaterally on the trapezius. And then I'm going to have you um, turn towards my hand. Beautiful. Turn towards my hand. Beautiful. 5 out of 5 strength. That's the sternocleidomastoid bone and the trapezia. Beautiful. All right. That concludes all of my cranial muscles or cranial nerves. And then I don't know if I said the one is the olfactory. I hope I did. Optic. 3. Okay, I missed one. So let me go back and do that. So 3 is the ocular motor, cranial nerve 3. So how we're going to do that is where I'm going to have you cover one eye. All right. And then I'm going to have you look at my finger. The first, the cranial nerve 3 ocular motor is going to be up, come back to center, and come down. No nystagmus noted. Coming out to abducens, cranial nerve 6, come back medially and down. That's cranial nerve 4. No nystagmus noted at all. All right. Okay. And same thing. So cranial nerve 3 is going to be up, back to center, down, cranial nerve 3, known as nystagmus, come out to center, or come out to the lateral side, which is obducens, come back to center, medial and down, which is trochlear, known as nystagmus noted there. Thank you for the ocular motor, cranial nerve 3. And then we did 3, 4, 5, 5, yep, 6, 7, 8, 9, 10, 11, and 12. Beautiful. Moving on from my cranial nerve. Thank you, Jesus. And we're going to move on to the neck. So the first thing I've noted about the neck is that that it is symmetrical. There is no tracheal deviation. The trachea is midline. I'm just going to feel ensure that it is. After I look, there's no redness, swelling, lumps, bumps, bruises, any discoloration like jaundice, no lesions, no scratches, no rashes, anything like that. I'm going to go in and palpate, and I'm going to touch here, make sure that the trachea is midline, and it is. Thank you for that. And then I'm going to go ahead and step behind her. And this, I'm going to locate the thyroid. So first I'm going to come in for the trachea. Oops, I'm sorry, I didn't mean to squeeze. Sorry about that. Okay, notate the trachea. Boom, locate the cricoid. And then the thyroid, go ahead and swallow. Beautiful. I notice rise and fall of the trachea and the thyroid. Beautiful. I'm going to displace it off to the side and note that there is no type of deviation. I'm sorry, there isn't any type of abnormalities. The borders feel nice and smooth. And I'm looking on the side, there's no goiters or any type of protrusions or lumps, bumps, or unexplained abnormalities in her neck. I'm also going to check the cervical spine, and I'm going to check at the top of the cervical. Any pain when I'm pushing down here, note that she has a strong cervical spine up and down. There's no crepitus or any type of tenderness when I touch here. I'm also going to notate the sternum as well. Any type of pain when I touch here, no crepitus or abnormalities or deviations at all with that. And then I'm going to move down to her from the neck to the chest. We're going to go into respiratory. So I'm going to notate her thorax, and then I'm going to just look for AP diameter. I'm looking for rise and fall of the chest for purposes of this video. It is going to be respiratory rate of 18, which I did not do your vital signs. So first I want to stop because I didn't do the vital signs in the beginning. And then I want to notate that her height, I took her height and weight. Her height is 5'4", her weight is 150. I want to notate that I also did her vital signs. So with her blood pressure, I did it supine first, and then I did it upright. Her blood pressure is 120/80. Her respiratory rate is 18. Heart rate is 80. Her temperature is 98, which is normal. Respiratory rate is 18. Breathing full and effective. And her saturations is 98% on room air. Beautiful. So right now I notice that your AP diameter is 1 to 2. There's no kind of like curvature of her spine. She has a great, nice, tall spine. Chest is normal. There's no type of redness, discoloration. There's no type of heaves or anything like that, or any type of traumatic look. There's no muscle accessory look. There's no muscle accessory use. There's no retractions. There's no orthopnea. There's no type of difficulty breathing or anything like that. And then I'm going to go in and start with my inspection and then palpate. I'm going to palpate for any type of tenderness. Please tell me if this hurts when I touch. Lift your breast tissue up. Beautiful. Does it hurt when I touch? Anything? No? All right, I'm going to do the same thing in the back. I'm going to touch here, touching all throughout the intercostal spaces. And anything hurt? All right, beautiful. Nothing hurts there. And then I'll come back here. And this is every time I touch you, go ahead and say 99, okay?
99, 99.
Breast tissue up. Beautiful.
99.
Touching the lateral sides. Nice. All right, notating that there is no crepitus or anything like that. Every time I touch you, say 99 in the back. Everything is normal. Great, beautiful job. Right here in the front, I'll go into the respiratory excursion. So sit up tall. I'll bring my thumbs together, pinch your meat, and then wrap my arms around her sides. Have you take a deep breath in. Notice rise and fall of my hand with her. Exhale out. Beautiful job. And notice that my hands move symmetrical on rise and fall. I'm going to do the same thing in the back. And then I'm going to have you take a deep breath in. Beautiful. I'm right here. Rise and fall. Beautiful. Right here, the costovertebral angles, I think, or at the 12th rib. Beautiful. Rise and fall of the chest and notated symmetry. All right, beautiful. Now I'm going to start here with percussion. And when I start for percussion, I'm going to avoid the bones because I don't want to hear dullness or anything. I want to hear tympanic. Oh, wait, I want to hear the intercostal space tympani. And I'm going to intercostal space in a ladder-like fashion, hitting all of the 8 breast tissue up, hitting the lateral sides, 8 lateral sides for the middle lobe, up and down. Beautiful. This side as well. Beautiful. And then I'm going to do the other side percussion, and I'll start on the right at the apices. Oops. Any type of pain or anything like that? Arms up. Or lateral side. Beautiful. Other side. Beautiful. Nice. No type of abnormality is noted. I heard tympanic. Anything over the bones would be dullness, which is what we don't want to hear. Right here, I'm also going to do the abdominal excursion, and I'm going to use my skin-friendly marker. Okay. In office, I would also have her shirt off, or at least down to a sports bra. But since we're here for her comfort, I'm leaving her shirt on. So I would lift this shirt up, and then have you sit up tall, please. Beautiful job. And then I'll come down to the rib, the 12th rib, and then actually I will not. I will just come here, and I'll have you take a deep breath in, and I'll start palpating up where I hear the first area of dullness, and I'll mark it here with my pen. Go ahead and take a breath out. Beautiful. Here I want you to take a deep breath in again. Deep, deep, deep. Open mouth, exhale all the way out and hold your breath out. Beautiful. And then I'll come down and I'll look for an area of dullness again. Boom, I hit it right here. And then I'll take the span of these two. Hers is breathe. Sorry about that. And I marked that one. And I'll take the span that I marked, and hers is 4. Normal is 3 to 5. In clinic, I would do this bilaterally, but for the sake of this video and my time, I'm just doing this one side. Okay. And then last but not least, I'm going to quotate. I'm going to start in the front, starting with the apices. Every time I touch you, go ahead and take a deep breath in and an open mouth exhale. Beautiful. Here, I'm listening for any type of rhonchi, any crackles, any wheezing. Lift your breast tissue up. Any type of abnormal breath sounds that you may hear. Beautiful job. Checking all 8 points with the lateral sides as well. And this lateral side as well. Beautiful job. Okay. And then, great job. I know you're probably hyperventilating, but great job. Then I'll move to the back, listening for the same thing, starting at the apices. And every time I touch, take a deep breath in with an open mouth exhale. Beautiful job. And then what I'm going to listen for is any type of adventitious breath sounds. So in the front, all I heard was bronchiovesicular breath sounds. The same thing that I'm hearing back here in the back are the bronchiovesicular breath sounds. No abnormalities at this time. No rails, no crackles, fine or coarse. Beautiful. Breath sounds sound really good. All right, that concludes my respiratory exam. So I'm going to put this away. All right, that concludes my respiratory exam. And then so we're going to move on to the heart exam and the cardiovascular exam. And so when I hit cardio, thank you. And then when I do the cardiovascular exam, I'm going to be notating any type of discoloration in the chest. Like I said, her shirt would be off in clinic, but for comfort is on here. So I'm going to notate the cardiovascular. Any type, I'm looking for any heaves or anything like that. I'm also looking for any precordial pulses or anything. I'm looking for any discoloration in the skin or anything like that. And then when I done looking, I'm going to go ahead and palpate. So where I'm going to start is the second intercostal space, which is the aortic area. And then I'm going to move over to the second this is the right sternal border. I'm going to move over to the second intercostal space of the left sternal border, which is the pulmonic area. I'm going to slide down and I'm feeling here. Okay. Any tenderness or anything when I touch? I'm going to move down to the third intercostal space, which is the Erb's point, moving down to the fourth intercostal space, which is the tricuspid. And then I'm going to come around here to the fifth midclavicular line, which is your PMI. I'm going to note that I do feel the pulsation, and it is less than 3, which is a normal finding. And that is it here. And then I'm going to go ahead and auscultate and listen those same exact areas. So I'm going to go ahead. So also I wanted to mention that my stethoscope does not have a bell. When I'm listening to the patient, like when I did for respiratory, I would, well, like this one, sorry, not respiratory. I don't think I need to do the bell and the diaphragm. Anyways, I'm just going to say it anyways. I don't have a bell, so I don't do the bell and the diaphragm. I just use my diaphragm. But if I had a bell, I would use a bell and a diaphragm through every time that I'm listening. So respiratory wise and here for cardiac. So since I have my diaphragm, that's what I'm going to use. I'm going to start here in a second intercostal space, and I'm going to, in the second intercostal space, the aortic area, listening for any bruits or thrills or anything like that. And then I'm going to move over to the second intercostal space of the pulmonic area. I'm move down to the Erb's point, third intercostal space, moving down to the tricuspid space, and then moving over to the PMI or the mitral space, and that's when I hear the less than 3 seconds. Normal findings. There's no flicks, cricks, or clicks, and no type of S3s, gallops, or extra beats noted at this time. All right, beautiful. So from this point, I will have you go ahead and lay down. So what I'm going to do is actually have you, can you lay the other way? Like your head down here? But what I'll do is I'll put your pillow. You can lay right here on this part. And then I'll put that one under your feet for comfort. Is that okay? Are you okay like this? Yep. All right, beautiful. And then I will go ahead. Oopsies, I'll move this over. Here, you can take your shirt off if you want. If you wanted, but you don't have to. I'm going to drape this over her. Okay, shirt's off. You can I'm going to put your pillow. I'm going to put this pillow under here for comfort for her. Beautiful. And then drape her with the. It's just a blanket, but I'm just going to use a drape. All right, and then I'm still on the cardiovascular. So what I'm going to notate here. So I'm going to have you look over to your left. Beautiful. Put your arms down by your side, please. All right, perfect. Right here, I'm noticing any jugular vein distension, any JVD. I don't see anything. I do see the pulsations of the JVD, but there is no JVD distension. I'm having you look back towards me. There is none on all the way, none on this side as well. Beautiful. So also, and I'm having you look straight ahead. So now that I'm looking for any type of JVD, any type of extra pulsations, or any type of heaves, lifts, or thrills, or whatever it is, I don't see any of that stuff. But I am going to palpate the jugular or the carotid pulse. So I'm going to come in, oopsies, and I'm filming the camera because I don't know if you can see me because I can't even see me. All right, so the carotid pulse, I'm going to go here. Beautiful. It is 2+, normal rate and rhythm, one side at a time. Then the other side, it is 2+ with a normal rate and rhythm. Beautiful. So that's the carotid pulses. Go ahead and take a listen to those as well. Notating for any bruits or thrills. Can you turn all the way towards me? Beautiful. Thank you. Nice. All right. Go ahead and turn all the way the opposite way. Listening here. No bruise or thrills noted. 2+. Rate and rhythm normal. And then I'm going to go ahead and listen to these. I'm not going to percuss. We don't percuss the heart. So I'm going to listen again as she lays down. And I'm in the second intercostal space of the aortic area, notating that there's no bruise or thrills noted. I'm going to go over to the pulmonic area. No bruise or thrills noted. I'm going to come down to Erb's point. No bruise or thrills. Down to tricuspid point. Beautiful. Move over to the mitral valve, and in the fifth inner midclavicular line, there's no bruise or thrills. Right here, I do notice that there's S1, S2, which is a normal finding. There is, oh yeah, when she was sitting up, I was also looking for aortic insufficiencies, but now she's laying down. Excuse me, goodness, thank you. I am not. I'm listening for any type of S2 splits, and I don't note anything like that, any gallops, any type of extra beats or anything like that. And I don't notice any thrills or anything like that. Everything is normal. Everything is normal. And your PMI, the point of maximal impulse, is here in the fifth intercostal space. So it is a normal finding. All right. And then I'm going to go ahead, since she already has her shirt off, I'm just going to pull the drape down. In office, I would obviously have her pants down a little bit more, but for the sake of the video, we will not be doing that. All right, so the first thing that I'm going to do is move on to my abdominal. That concludes my cardiac exam. You can go ahead and look forward if you want. So I'm going to notate any abdominal distension, any type of hernia, any discoloration, any type of extra pulsations or aortic pulsations, or any type of peristalsis or anything like that. Any abnormalities in the tummy, in the context, any striae, any bruising lumps, any scrapes, any lacerations, anything that is out of the normal for it. That's where I'm going to view it. And then, so after I view it, I'm going to go ahead and take a listen. But where I'm going to start listening is the abdominal aorta, which is above the umbilicus. I'm going to listen here at the abdominal aorta for any brills or bruise, and I don't notate any. I'm going to go out to the right renal artery, no bruise or thrills. The left renal artery, no bruise or thrills. Come down to the iliac crest, no bruise or thrills. On the right side, the left iliac crest, no bruise or thrills. It is 2+, no bruise or thrills. Each one is 2+, with normal rate and rhythm. And then I'm going to come down and listen. Sorry, I'm not palpating that. Sorry, I didn't mean to say 2+. I'm just saying that there's no bruise or thrills. And then I'm going to go down. Is my mic on still, right? Okay. And then I'm going to go down to the femoral artery on the right side, femoral artery on the left side, just listening. Beautiful. And those are all normal sounds, no bruise or thrills noted. Then I'm going to come back to the quadrants of the belly, starting in the right lower quadrant, listening for 5 to 34 sounds in the abdomen. There's normal tone in each one. Right lower quadrant, moving up to the right upper quadrant, same thing, 5 to 34, normal tone. Left upper quadrant, same thing. Right lower quadrant, I noted the same thing and the same sounds. It is normal, 5 to 34. And then once I'm done listening, I'm going to percuss or palpate. I'm going to percuss. So I'm going to start in the lower right quadrant, percussing here. Yay, noting sounds of timpani, moving up into the right upper quadrant, moving over to the right or the left upper quadrant, down to the left lower quadrant. Beautiful. Noting timpani and no areas of dullness. I'm also going to percuss over the bladder. She emptied her bladder before the exam. If she didn't, it would be tympanic. Then I'm going to make my way over and percuss the liver. So I'm going to come into the right upper quadrant and I'm going to note the first area of dullness. Nice. And then I'm going to use my skin-friendly marker. That's the first mark. And then I'm going to go up to the midclavicular line that splits the nipple, come down and percuss. Nice. And I'm going to go, this span is going to be, where's my crap? Oh, okay. So this span is, whoopsies. Whoops. All right, percuss that again. The span is about 8, which is normal because the liver is 6 to 12. Oh, sorry, we'll have to get that off later. Sorry about that. All right, and I'm going to go over here and I'm going to percuss the spleen. So I'm going to come to the 12th rib and I'm going to percuss up to the 10th rib. I am unable to percuss the spleen. And I'm going to have you take a deep breath in. Beautiful. And hold, exhale. All right, beautiful. I'm unable to palpate or percuss the spleen, which is a normal finding. If I was, it would be splenomegaly. And then I'm going to come back to the abdominal area and go into palpitation, which is going to start with one hand and light touches in the right quadrant. Any pain or anything like that? Any pain associated with me touching? So the right upper quadrant, the left upper quadrant, palpating deep, not deep yet, but just lightly. And then I'm also going to palpate then all the quadrants, and then I'm going to palpate the liver. I'm going to come up to here and have you go ahead and take a deep breath in. Beautiful. And then and go ahead and let it out. Beautiful. I noticed that the liver did touch the border of my fingertips. Oh my God, I got this everywhere. My fingertips, which is a normal finding. No type of abnormalities noted. It is fine. It is a normal finding and a normal when it touches the border, the inferior border of the liver touches my fingertips. There were no rigidity or anything like that. I'm also going to palpate the inguinal hernias here, left and right side. This was the left side inguinal hernia. I'm sorry, the inguinal lymph nodes. The inguinal lymph nodes. And actually, before I forget, can I see this arm? Can you leave your arms down by your side, please? I'm going to do the epitrochlear lymph nodes and the axillary lymph nodes because I don't want to forget, and I will. All right, then leave these down by your side. So then I'm going to also palpate the femoral artery, the right side, and then the left-sided femoral artery, staying on top of her clothes just for this video. Beautiful. And then I'm going to go over here and try to palpate the spleen again and take a deep breath in. I'm unable to do that. Beautiful. And then I'm going to come around to this side. I'm going to have you take a deep breath in. I do not feel the pull of the left kidney, normal finding. Go ahead and take a deep breath in here. I do not feel the pull of the kidneys on this side as well. So, which is a normal finding. So I'm going to do a deeper percussion or deeper palpation now with both hands. Any pain? Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, any type of pain. And then I'm going to come down to the umbilicus on both sides and I'm going to notate. I'm going to deeply palpate for the aortic pulse. Oh, I do feel it. All right, it is 2+, normal rate and rhythm, no abnormalities noted here. And then that's when I do the femoral artery, the left one. Okay, I did out of order. Sorry about that. And then I'm going to go ahead and, inspect, palpate, auscultate, percuss. All right, I think I'm done with the abdomen. And then I'm going to have you go ahead and sit up and put your feet over on that side so that your back can be to the camera. Okay, back to the camera, and I'm going to do your costovertebral. Any pain here? There's no pyelonephritis at this time. Okay, and then I notate that there's no pain or things like that. Okay, go ahead and come around, turn back towards me. We're going to do the upper, and we're going to do, sorry about that, the upper extremities. So just in case I was out of the camera, I don't know if I went out of the camera or not, but anyways, here is a rescan just in case there's any issues at all. Okay, make the camera better. All right, so anyways, a rescan just in case it is needed. And then I'm just gonna, put everything to the side. And then we're gonna do the upper extremities and the lower extremities, looking at the upper extremities. I'm going to I'm gonna notate that there's no Heathcliff no Heath or cliffs or anything noted. There's no discoloration, there's no lesions or anything like that for the upper extremities. There's no discoloration, there's no discoloring of the toes. I'm going to go ahead and start touching. Do any tenderness when I'm touching here. So I'm going to start with your fingers, your dips, your pips, and your MCPs, metatarpals, and tarpals. and I'm going to make my way up to the radial portion here, and then I'm going to look at the elbows, the insides of it, any painful, the biceps, triceps. I'm going to go into these inner crevices, your deltoids, your triceps, any of your trochanters. I forgot the names of these, the epicanther, epiculture, whatever. I don't remember the names of these. And then any type of stiffness or anything like that, any type of pain. Okay, there's no crepitus, there's no abnormalities, there's no rheumatoid arthritis or anything like that. I'm going to do the same thing with the bottom of your feet here. Okay, beautiful. Okay, beautiful here. There's nothing with the feet, and then we're going to test your range of motion. So I will have you extend your hands out towards me. Beautiful. Abduct with your hands. Abduction, which is away from your body. Adduction is in towards your body. I'm going to have you flex down, and then press up. Okay, and then spread them out, and then here. Okay, beautiful. And then there's equal. Okay, and then open up. Don't let me close them. Beautiful, close. Try to open them. Beautiful. Strengthen your hands up and down. And then I'm going to have you do a range of motion. Have you abduction away. Abduction. Okay, adduction towards your body. Beautiful. And then I'll have you flex out. Flex out. Beautiful. Extend back. All right. Beautiful. There's nice range of motion. There's no type of abnormalities with her. The camera. There's no type of abnormalities with her range of motion. And then I'm going to have to check your strength. So go ahead and biceps up. All right, don't let me pull. Beautiful, don't let me push. Beautiful, and then don't let me pull out. Beautiful, don't let me push in. Beautiful, the deltoids and the triceps and the biceps are all strong. Arms are strong. And extremities, I'm doing the same thing at the bottom. Don't let me pull. Beautiful, your hips and don't let me push in. So these are the hip strength, the quad strength, and then your foot flex up. Good, press down like you're pushing a gas pedal. Beautiful, and I'm gonna check your toesies. There's beautiful, there's no type of cyanosis or redness or swelling. And then cap refill is normal, less than 3 seconds on the toes and clean my hands, on your toes and your fingertips. Let's see your fingertips again. Check your cap refill, everything like that. All right, and then I'll have you, we'll do your range of motion standing up, please. Stand up. And then I'll have you flex your leg forward. Flex forward, extend back, abduct away from your body, adduct towards your body. Beautiful job. And then I'll have you do the rotator for internal rotation, external. Internal is to bring your heel in. External is to bring your heel out. Flex your toes up, and extend out, and then flex them back. Beautiful. Flex back and then come down. Same thing on the other side is internally rotate in, externally rotate out. Beautiful. Extend your leg up, flex your toes, and extend back. Beautiful job. And then I'll have you walk her gait. So I'll have you walk over to the chair, and then have you walk back to me. Beautiful gait, beautiful normal gait. And then here I'm also gonna, can you step back a little bit for the camera? Beautiful, right there. And then I'm gonna check her hips and notice that there's symmetry in her shoulders and her hips. Any type of pain or anything like that. This is the iliac crest. There's no type of pain on her hips or iliac crest. I'm gonna go to the back and notate the cervical spine. Is there any pain or anything when I touch right here? There is symmetrical here, and then do the Romberg sex. Extend your arms out, close your eyes. Flip your palms over like you're gonna hold a pizza box. Hold here. Beautiful job. And then I'm gonna push down. Beautiful. Don't really push up. Beautiful. All right. And then I'm gonna put your arms down, open your eyes, have you do the tandem walk. Heel to toe, and then come back. Come back for heel to toe again. All right, heel to toe. Beautiful job. And then I have 2 minutes. Okay, so oh yeah, come close to me. All right, and then come over here by the camera. And I don't remember. Okay, so also I want to check. I did check the elbows here, all of these. I checked for crepitus. Go ahead and go into the camera. Come into the camera. Okay, and then I want you to turn your head to the side, and then back here, and come back to center, and then here, right center, and then here, and then flex down, and then go ahead, move up, and then back. Oh God, almost missed it. Okay, at least I got some points. And then anything else, I don't remember. So thank you for watching. I'm just gonna go ahead and grade this myself. That's it.